Welcome to the 2014 ASHP Foundation Literature Awards presentation and breakfast. Since 1971, the program has recognized more than 600 authors and over 150 articles published in biomedical literature. Let's meet the latest awardees to join this prestigious group. The Student Research Award goes to Jennifer K. Fan and Sachin A. Shah of the University of the Pacific in Stockton, California. Their article, Effect of Caffeinated versus Non-Caffeinated Energy Drinks on Central Blood Pressures, was published in the journal Pharmacotherapy.
Energy drink consumptions have been on the rise. And with its high caffeine content, energy drinks can be easily consumed in excess, leading to toxic effects. Central blood pressure is a superior predicator of adverse cardiovascular disease than peripheral blood pressure. And although the central hemodynamic effects of caffeine have been studied, the central hemodynamic effects of energy drinks have not prior to our study. And while the results show energy drink consumption does increase central blood pressure on healthy volunteers, imagine the effects it could have on older patients or those with pre-existing health conditions. Pharmacists are trusted healthcare professionals, and this research can help pharmacists educate patients to make informed decisions about their energy drink consumption and hopefully influence lifestyle modifications that encourage more quality sleep and healthier diets.
The Pharmacy Practice Research Award goes to Marie A. Chisholm Burns and her colleagues at the University of Tennessee College of Pharmacy in Memphis. Their article, Improving Outcomes of Renal Transplant Recipients with Behavioral Adherence Contracts, a randomized controlled trial, was published in the American Journal of Transplantation.
To address the question of why we chose the focus of our study and its significance to pharmacy, we wanted to implement an intervention to improve adherence in the renal transplant population. As we all know, the World Health Organization has noted that non-adherence to long-term therapy averages 50% in developed countries such as the United States, and it severely compromises treatment effectiveness. Medication adherence is a struggle for our patients, in particular renal transplant recipients, and this is because of a variety of reasons. Having worked with transplant recipients for several years, I wanted to design and implement an effective but simple intervention to help confront these challenges. I believe the behavioral contracts interventions in this study achieves these goals in a cost-effective manner. As a result, pharmacists now have an evidence-based tool available to facilitate medication adherence.
The Drug Therapy Research Award goes to Brian T. Bateman, Katerina Bykov, and their colleagues from Brigham and Women's Hospital and Harvard Medical School in Boston, Massachusetts. Their article, Type of Stress Ulcer Prophylaxis and Risk of Nosocomial Pneumonia in Cardiac Surgical Patients, Cohort Study, was published in the BMJ.
Each year, close to 800,000 patients undergo CABG surgery worldwide, and following the surgery, most patients are administered acid-suppressive medications for stress ulcer prophylaxis. Several previous studies have associated the use of these medications with increased risk of pneumonia, which is a highly morbid complication in this patient population. The findings, however, were not consistent, and it was not clear if the risk was the same across all therapeutic options. In this analysis, we found an elevated pneumonia risk in those who were administered PPIs as compared to H2 receptor antagonists. Given the widespread use of these agents and the consequences of pneumonia complication, the differential risk should be taken into account when selecting the type of agent used for stress ulcer prophylaxis following cardiac surgery.
The award for innovation in pharmacy practice goes to Joseph L. Cesars and his colleagues from the University of Wisconsin Hospital and Clinics in Madison. Their article, Emergency Department Discharge Prescription Interventions by Emergency Medicine Pharmacists, was published in the Annals of Emergency Medicine.
So what is the significance of this project to the profession of pharmacy? While our project team anticipated that emergency medicine pharmacists would make an impact through reviewing these prescriptions, there are also some thoughts that the decision support built within the electronic medical record would limit the interventions that pharmacists could make. After analyzing the results of the project, we realized that pharmacists did make a significant improvement in both the efficacy and safety of prescriptions leaving the emergency department. The baseline intervention rate of 10% on these prescriptions was impressive, but when we looked specifically at pediatric patients, we found a pharmacist intervention rate of nearly 25%. To us, this was one of the more significant findings of the study. Extrapolating over a year, we found that pharmacists would make nearly 1,180 prescription interventions annually. So while we confirmed our hypothesis that pharmacists could make an impact, I believe we demonstrated the degree of impact and importance these interventions can make during the emergency department discharge transition of care. In addition, this further solidifies that bringing in the pharmacist at the prescribing phase in the emergency department has additional benefit that allows optimal medication prescribing directly with the prescriber, as some interventions and errors are unrecoverable at the dispensing stage in the process.
And this year's award for sustained contributions goes to Glenn T. Schumacher, Department of Pharmacy Systems, Outcomes and Policy, College of Pharmacy at the University of Illinois at Chicago.
It really means a lot to me to receive the award for sustained contribution to the literature from the ASHP Foundation. I've held several positions in pharmacy over the last 25 years, and in each one, whether as a clinical pharmacist, pharmacy manager, pharmacy director, or now academic, I've always put considerable time into practice-based research and into publishing those experiences and research findings. I did this both because I enjoyed it, but also because I thought it was needed. I hoped that I might contribute, if even in a small way, to the evidence base in pharmacy practice, and by doing so benefit patients and others in the profession of pharmacy. So being recognized by my peers for that work via this award is extremely gratifying. And in the same way that previous winners of the award have inspired me, I hope that some of what I have done will inspire others to contribute to our literature. Thank you.
Congratulations to all of our 2014 Literature Awards recipients.